When you look at all of these cancers and all of them are exhibiting signs of gut dysbiosis and imbalance, there's something to be said there. And now, with more modern research indicating, wow, there's something actually linking some of these very specific cancers. And I think in the next, 1 to 5 years, we'll see that for even more cancers than we're already currently aware of.
Hi, everybody. Welcome in for another exciting topic here. We're going to talk today about the gut microbiome and fecal microbiota transplantation, or FMT, in the realm of oncology. And so for everyone that's joining us for the first time, please go back and listen to some of the other videos so you can really understand what the gut microbiome is and what FMT is. And if you're joining us on the regular, please subscribe so that you don't miss any of the videos and that we know what topics are of most interest to you so we can keep diving into those. So this is a really hot topic. There's a big growth in the idea that the gut microbiome is playing a role in oncology and trying to harness microbiome therapies for cancer treatment and trying to see, how these puzzles all come together. And so we know that the gut microbiome is playing a role in cancer because not only is the gut microbiome really key to your health and wellness and playing a role in metabolism and the immune system, but we're seeing growing evidence linking dysbiosis or dysfunction in the gut to cancer development and progression. And so this is something that it makes sense in terms of, inflammation and immune regulation and that being in cancer, but we're seeing now that the gut is really becoming part of the story.
Yeah, and just jumping in, I remember this was probably like a year or 2 years ago, and I looked up, and it was less obvious then that there was a direct link. I know there's now like a more direct link between some cancers, now not all, but a few cancers and immune dysbiosis or gut imbalance. And so I looked up all of the major cancers and started saying pancreatic cancer and gut microbiome and, liver cancer and gut microbiome. I just basically took all of the major cancers and then looked at the data that was being published around a gut dysbiosis imbalance and that cancer. And it's a really compelling thing to look at them all and see, wow, all of them have gut dysbiosis, generally speaking, as a part of the signs and symptoms at the time of diagnosis or during the treatment course. Now, again, that's not a direct link saying gut dysbiosis caused liver cancer or caused pancreatic cancer or caused lung cancer. But it starts to beg the question, right? When you look at all of these cancers and all of them are exhibiting signs of gut dysbiosis and imbalance, there's something to be said there. And now, with more modern research indicating, wow, there's something actually linking some of these very specific cancers. And I think in the next, 1 to 5 years, we'll see that for even more cancers than we're already currently aware of.
Yeah, gut dysbiosis is a driver of chronic inflammation, but also DNA damage, immune dysfunction, which are all tied in with some of the symptoms we see in cancer as well. But it also changes the gut environment, which can help kind of propagate some of these issues. And when you're talking about, originally this research started with gut dysbiosis playing a role in gastrointestinal cancers. And now we're seeing that kind of grow, where there's some really good research in the role of gut playing or being dysfunctional in breast cancer, liver cancer, skin cancers, things like that. So we're seeing that there's a root here where the gut microbiome is playing some role, be that causative or as a secondary kind of symptom to the cancer, but it seems to be tied in. So it's definitely part of why we're seeing modulating the gut microbiome or restoring the gut microbiome be a novel strategy to improve what we're currently already doing for cancer therapies.
And I would just add too, that's sort of come along at the same side as we're recognizing that, yes, the microbiome is affecting more than just the organs associated with digestion, right? You could link, the pancreas, you could link the liver, and of course colorectal and other things directly to the digestive system. But we're recognizing at the same time, as we're seeing this gut and skin and gut and other connections from a cancer perspective to other disease states like neurological diseases, where previously we didn't think the gut had anything to do with the brain, right? What does the gut have to do with the progression of Parkinson's disease or multiple sclerosis? And so I think those two are coming hand in hand. We're realizing, wow, the gut has an interplay with pretty much every major organ system in the body, and also the diseases that are associated with that. So it's really cool to see how those two awarenesses are coming hand in hand from a cancer perspective, and then just a disease outside of the gut perspective as well. So it's really cool that that's happening, and we're creating more awareness. And then, of course, with that awareness comes an understanding like, wow, if we manipulate the gut in a positive way, we can improve the outcomes that we're seeing from a treatment perspective, a prevention perspective, and so on.
Yeah, and we're seeing the idea of adding in restoring the gut as part of a treatment protocol, kind of being that first approach, which I think is key, because let's see if in combination, and we know that specifically in oncology, but in other areas, restoring the gut microbiome helps how well the treatment is going to work, or helping people become responders when they're non-responders. And I think in terms of having previously come from a very basic science perspective when I first started on my science journey, there are trends in science, but it's one of the big changes. And I think finding the gut-brain connection, at least from a neuroscience perspective, because I lived in that little bubble, but I think we're seeing it in science and in medicine, functional or integrative, or thinking of the body as a whole instead of separate units. And I think the connections in the gut are either helping that or supporting the idea that we need to do that, because previously, if you had something wrong with your brain, they just looked at your brain. Like, why look anywhere else? The problem is right here. And now we're getting more of this like systemic approach, the idea that like there are multiple things feeding in. The brain does not live completely separate from the rest of the body. Similarly, the heart and the lungs. And I think that is changing how we're approaching treatment. And we talk a lot about the gut because we are gut people, but it's happening throughout medicine and science. And I think the gut microbiome is playing a supportive or driving role in that, because the more you look, the more you realize that the gut is playing a big role in connecting a lot of these systems.
Right. It's just like gravity to the universe. Microbiome is like the gravity of the body, right? If we didn't have gravity in the universe that was very carefully controlled, we'd end up with, explosions and implosions, and we'd lose the sun and the moon would disappear. And so I think more and more people are starting to understand, like, yeah, we have to take this whole body approach instead of just a systems approach, which has worked to get us where we are. But, going to the next phase, the combination of looking at the whole body and then an individualized approach to patient care, I think is, when those two come together in a much more, data-driven way, we'll get much better treatment outcomes. And of course, my goal is always like, let's try to get prevention. Prevention is the key. But if we can't prevent, what can we do to, get a much better survival rate? And that's ultimately what's happening here, right? Like, it's a very simplistic model. Having a gut imbalance ultimately creates inflammation, and inflammation causes DNA damage over a sustained amount of time. I mean, we can just think about it even in a simpler state. Like, if you have inflammation in a joint for an extended period of time, you get a breakdown of that joint. The cartilage gets eaten up by the inflammation, and eventually you've got arthritis. And then if you've got arthritis, eventually you're going to need to have a knee or a hip or whatever replacement. So inflammation is really the foundation of all disease. And we need to think about how we can modulate the immune system and the immune response to reduce the inflammatory nature. And then how can we support the microbiome, which ultimately creates anti-inflammatory compounds to reduce inflammation both within the gut and then inflammation that tracks throughout the body. And ultimately, again, sustained inflammation causes DNA damage. DNA damage is the result of which ultimately leads to cancer. But there's a whole system in between DNA damage and actual cancer that leads to the development and eventual diagnosis of cancer. And that's where the metabolic system plays a role as well, right? Like, we have a system that can identify inflammation and DNA damage and try to repair it. And the microbiome plays a role there as well. So it's really complex when you look at the whole system, but pretty simple when you really break it down to the nuts and bolts.
Yeah. And I think the first logical, and there were other steps, but mainly the big lean into gut restoration or fixing gut dysbiosis was FMT. So fecal microbiota transplantation has been kind of looked at as a novel strategy to improve traditional oncology treatments. And so FMT is basically transferring a healthy gut microbiome from a healthy, well-screened donor, and then putting that into a patient that needs to restore the balance within their gut. And within oncology, kind of the mechanisms here, the thought is that it's going to play a role in immune modulation. It's going to correct the gut dysbiosis that's there. It's going to help rebalance the metabolic system and help with restoring the types of metabolites the body is making and has been deficient in, which then supports response to treatment, but as well as overall health and wellness within the system. And so
I think it would be great if we could cover the, maybe this is a little bit of an interruption in the flow, but cover the study that was done on the melanomas and how they were actually using responders to the, they treated patients, and you can describe it better than me, but they had melanoma patients who responded to the intervention, and they had patients who didn't respond. And so they used the responders as the donors, which is like very contrary to what you would normally think, right? You'd think you'd want a really healthy person, but they're like, wait a minute, the microbiome of the responder clearly worked for them, so let's give it to the non-responders.Maybe you could provide a little more light on that, and this will be, a bit of a highlight for people.
Yeah, and so the idea here is this was in immune modulation or immune checkpoint inhibitors, and a lot of people do not respond to this therapy. It is extremely effective when you're a responder, but there is a group that does not respond. And the idea here is when they were looking at what the difference between responders and non-responders is, it appeared that there was something within the gut microbiome. And generally, we know that having a healthier gut microbiome seems to lead to better treatment outcomes in oncology. And specifically within this group, it seemed like responders had a specific pattern that non-responders were lacking certain bacteria. So what they did is they took from responders who were in a partial or complete remission, took their gut microbiome and put it in using as an FMT to non-responders. And what they saw was a huge increase in the response rate of those previously non-responding patients. And so this kind of supports the idea that having some kind of makeup within your gut microbiome can help how you respond. And generally, we're seeing studies that look at doing FMT in terms of immune modulation within cancer. You get better outcomes or better response rates when the gut microbiome has been restored or throughout the treatment process. FMT is being administered, basically keeping the gut healthy throughout all of these treatments. And that helps with the response rates. As well as it plays a big role in reducing side effects. So we have this kind of twofold where we see FMT plays a role in restoring the gut, which then leads to or plays a role in improving treatment response rates. But as well, by restoring the gut microbiome, you can reduce toxicity responses, you can restore the gut, which we know plays a role in a number of things. But with all of the toxicities and all of the antibiotic use, by restoring the gut microbiome, you're restoring overall health, which helps kind of come back from kind of the negative side effects of treatment.
Yeah, and the reason why that's actually really important is because that's what stops some of the treatment too early. And with the conventional oncology approach to treatment, it's like, how much of ultimately this poison can we give them where they can still live and manage through the side effects? And so by improving the response rate, that really helps, but then also minimizing the side effects, it allows you to treat more, like a higher dose for longer, which in the context of some of these cancers is a really important piece. If you're only able to treat for half the time that would be suggested based on the research, you're unlikely to get the full response to care. And so there's a really important piece here where even adding 10% to the amount of the drug and or the length of the intervention could be very meaningful from a survival standpoint. And so, of course, I mean, I'm a huge advocate of holistic integrative cancer treatment. where conventional treatment can be a part of it. But just in the context of conventional treatment, this is a really big breakthrough and could mean a huge difference when it comes to the actual survival when using these standalone therapies. So very, very transformative in the context of what we've been seeing happening. Like as there's not a huge, surge of new conventional cancer treatment options out there, but just this microbiome piece alone could be transformative and really set the stage for what the future of cancer care looks like.
Yeah, and by restoring the gut microbiome and kind of increasing that diversity within the gut, you can help protect or restore the intestinal barrier, which plays a big role, reduce inflammation, improve the rate at which you see recovery. And that recovery is also from the treatment, right? So that's part of the process of these traditional cancer approaches, is that there's a recovery period. You have to recover from getting the treatment. And one of the big things that I see within the literature is when we're reading from a case study perspective or small clinical trial perspective, one of the things with applying FMT and reducing some of these side effects is keeping people getting the treatment. Because you have people that go, it's not worth the side effects, or being hesitant to get the treatment because they know the side effects exist. So by helping reduce those, you have people that stay kind of on the treatment bandwagon, seeing the positive effects because they're not being dragged down by so many side effects. And then the other big one, which I'm sure we'll talk about again because it's really surrounding kind of the use of stem cells, but graft versus host disease, which is one of the biggest kind of barriers to success with stem cell treatment, is the body kind of rejecting it or causing inflammation that doesn't allow for the treatment to be effective. So by applying FMT within a graft versus host, and so the more I look into this, we're kind of looking at, how do we use FMT? Is it better to do FMT before doing stem cells, during stem cells, after stem cells? Do we want to treat graft versus host when it starts, or do we want to prevent it? So everyone's kind of coming at it from every perspective. There's a little bit of maybe it's better to do before and then see, or do during. But there's a really strong base of evidence using FMT in the context of graft versus host. And the clinical evidence is really seeing, reduced inflammation, improved immune tolerance, and better outcomes post graft versus host in both the acute and the chronic situation. And most of it is looking at acute graft versus host right now, but there is more, and we're seeing even better responses to traditional treatments for graft versus host when used in conjunction with FMT, so steroid-based treatments. So again, not only with traditional treatments to deal with the cancer itself, but in terms of side effects, FMT can also help with either reducing the presence of graft versus host or help bolster the treatment to kind of resolve it. And I think it's one of those preventative versus responsive. We're kind of studying both of those to see what's the better approach. But because graft versus host is so prevalent in stem cell responses, or when you're getting stem cell treatment, that it does seem, at least from my reading, and I'm sure we'll talk about this again and maybe I'll change my mind, but the idea of preventing it and then if necessary going back in and responding does seem to make the most sense when you have such a large population of people that are going to see this side effect. And that really is quite detrimental to the response to the treatment, because the amount of things you have to do to resolve graft versus host would then impact the transplant itself.
And I think a lot of what we've been talking about here today is really looking at this more from a black and white, like conventional approach to cancer care, and then FMT or microbiome therapeutics integrated into that. And I think that's like where all of the data is. And so that's why we're talking about it. But a lot of the doctors that we talk to on a regular basis, whether we're seeing them at conferences or we're reaching out via our videos or social media or all the different things, are actually doing complementary integrative cancer care. And again, unfortunately, there's not a ton of research, although it's evolving very quickly in that space as well. The role of improving gut function, and we've talked about this a little bit, will just at a very simple level improve digestion and absorption. And absorption is critical when you're taking a lot of supplements orally, right? A lot of the supplements that are used in complementary integrative cancer care are taken orally. Patients are often in high doses of IV vitamins and other nutrients that can be applied via IV. But the mainstay of all those treatment modalities is going to be high doses of supplements, and a lot of them during the cancer treatment journey to help minimize side effects, to help improve the immune system and the dysregulation that's happening there. But if the patient's gut is on fire and it's inflamed, they're just not going to be absorbing well. And so this is a huge complementary addition, right? It will work really well synergistically with the other types of therapies that a patient might be on if they're following more of an integrative approach to cancer care. And I think more than ever, patients are recognizing an integrative complementary approach to treatment is going to get the best outcomes, even if it's just minimizing side effects, which again can be very debilitating and be the reason why patients don't progress or even choose to do conventional cancer care, which in some cases is absolutely indicated based on the data. Of course, in other cases, the outcomes are pretty minimal comparatively. And so I really understand why some people choose to just say, you know what, no thanks. But really, I think to the functional, integrative, medical, naturopathic, etc. doctors who may well be tuning into this, like this is a really great addition to the other complementary integrative choices that you have and that you can provide to patients who are looking to both enhance treatment outcomes, minimize side effects, potentially prevent graft versus host and or improve the response when it's developed. And so this is, I think, a really exciting time. And if you agree, I think we can digress slightly to the, post-cancer. So someone's no longer diagnosed with the cancer and what that looks like. So I don't know. I'd love to share a patient case that I have direct experience in. But if you have anything else that you want to cover there, then we'll leave it with you to start.
Yeah. So I think it helps with recovery. And I think the only real research on this is basically restoring the gut microbiome post-treatment, because after all the antibiotics, after the chemos and the radiation, your body needs support to kind of recover. And from the minimal research that's there in post-cancer, a lot of it is looking at FMT during the cancer period, even after chemo radiation, adding it in, but not considered post-cancer as much because you're still kind of in this window. But it's recovering from everything that's been done and really restoring overall wellness by reducing, inflammation, restoring the gut microbiome, and allowing kind of returning back to a more normal balance to allow for, restoring what your gut's able to make. One of the big ones being short chain fatty acids and the metabolites and the vitamins and your body's ability to do that. That's been the big one, but I think there's still a lot of research in terms of post-cancer and just overall kind of restoring everything that was done to get us to that kind of remission period.
Right. And I think that's the main concern, right? You get into remission. It's like, wow, that's amazing. The next immediate concern is, how do I prevent this from coming back again? Because that's invariably what happens with a lot of these cancers, right? They return, or they return in a different part of the body. And that's the main concern every day thereafter. So that's a big concern. And I think generally speaking, conventional medicine is very focused around dealing with the immediate problem at hand. And then once it's done, it's like, okay, oncologist is out of the way, you just go do your thing. And so I think the ball is really dropped, generally speaking, in that post-cancer care. And that's where there's a real opportunity to prevent it, improve the quality of life following cancer diagnosis. Conventional cancer care takes you inches to millimeters from death. That's ultimately what we're doing when we're trying to kill the cancers, because it's going after every rapidly dividing cell in the context of, say, chemo. And a lot of cells in our body are rapidly dividing, including the gut. And so it's very damaging to a lot of membranes, a lot of organs. And so the opportunity now in the post-cancer, and we're in remission, is to try to prevent a recurrence and then dramatically, where possible, speed up the recovery of all of these cells that have been damaged and improve quality of life. So that patient case that I was referring to was many years ago. I would say around 2018, 19, I had someone when we were treating patients still in Mexico. They came to me and they had ovarian cancer, I think 16 years prior to actually reaching out to me. And her husband, we had a nice conversation, and there was a whole, process of getting treatment started in collaboration with the doctors there and whatnot. But she had thankfully recovered from this ovarian cancer, and she had needed chemo and radiation, which we both know are very damaging. And then, of course, just on where the location is, it's right on the abdomen, right? So it's right where all of the microbiome would be taking place. Where the most of the microbes are is in the colon, and the ovaries and the colon are right there. And so she had survived this treatment and was cancer-free for 16 years following, which again, on a metric standpoint, is very impressive. But from a quality of life standpoint, she was struggling significantly. She literally could not break down fibrous foods, which we know the microbiome, that's basically what it's for. It helps to break down the fiber in our diet and turn it into really healthful things. And so anytime she would even have a minuscule amount of fiber, it would lead to bowel obstruction, which like your bowels basically shut down. And if your bowels shut down for long enough, you're at risk of a perforation of your bowel, and that could cause sepsis, and boom, you're dead in a very short amount of time. So anytime she would eat even a small amount of fiber, it would result in her having to go to the ER, and they'd have to, do some interventions to break down this obstruction, get her to clear out, and then she'd, go back home. Each time, very psychologically a burden, just a lot of fear around what she would eat and if it would be too much fiber. Because it's hard, honestly, to get rid of all fiber. It's in basically everything other than just like sugar. And so it was really a tough place for her. She survived the cancer, and she just mentioned to me, like, I'd almost be better off not having made it, because her quality of life was just that horrendous. And so at that point, it was, well before we had developed some of the delivery mechanisms that we have now, which of course include capsules. But at that point, we were just doing enemas, and she was the course of treatment was to do a 10-day enema treatment protocol. And within the first 2-3 days of treatment, she was already improving significantly. Just her mental outlook, physically improved energy. She was already experimenting with different foods, although very cautiously. I was advising, we don't want her to end up in the hospital here with another bowel obstruction. But it was such a spectacular change in such a short order. And even while there, it was really funny because her husband came to me and he said to me, look, she's reminding me of the wife that I had, 15, 20 years ago, because she's on my case now. She's got energy to, sort of harp on me a little bit. But she was telling me she was ordering like backsplash for her kitchen, and she was ordering, stuff from a landscaping perspective to do outdoor projects, things that she would just never have considered. Now, for context, she was in her 70s at this point, and she was exhibiting energy like she had in her 50s and an outlook that was way more positive. And, it's all well and good while someone's on treatment to see improvement. But what was really cool is this patient stayed in touch with me roughly every year and continues to reach out to me every year, sends me the odd photo, is super grateful. And it's such an encouraging piece. But I think, this is just, of course, one case. And it just, highlighted to me because of the transformation of how quickly she transformed, and then just how the treatment sustained over all of that time. She didn't need to keep getting more FMT. And now, if that was the patient that came to me, if I had still been treating patients, I would have been much more, saying, look, let's treat for a longer period of time. Let's do oral capsules. Let's potentially do a booster dose every year or 2 years. But just such an amazing case and story of how positively this person was affected. And I think, again, the reason why I wanted to highlight this is just because often patients are dropped off once they hit a remission standpoint. But that's where the real work begins. You develop this cancer for a reason. We need to understand what that reason is and what can be done to prevent it from happening again, and then improving the quality of life that you have left. Like, look, you've survived, and that's amazing. What's the point of living when your quality of life is so horrible that you have a fear of almost eating anything? Where's the joy, right? And then just the fear and the psychological damage that comes from each time having to get to urgent care and then, barely surviving, but surviving. And so it was just a really, for me, impactful part of my journey as a healthcare provider, and even, the world that we live in now, and our mission at Novel Biome to expand access to FMT care is because of patients like this. And so if you're a healthcare provider and you can relate, you have these patients, like, reach out. We want to support you in helping those exact people. And then, of course, from a cancer care perspective, there's a lot that can be done there too. So that's it.
And I think you highlight something that I feel like we don't really talk about much, but the gut microbiome plays a huge role in mood, and it regulates a lot of the neurotransmitters that play a role in mood. And so gut dysfunction, in terms of in oncology, where getting cancer is jarring. It can change your perspective on pretty much everything. And be that if you get it when you're younger or older, it really does. And it impacts everything. And so mood is going to be impacted. But can you imagine on top of that, this gut dysfunction, especially for the long-term and post-cancer, the likelihood of increased, depressive or anxiety-based symptoms, and also modulation in what you can eat, which then can extend or impact how bad the gut dysfunction is. Hearing that, all of the things that come together with restoring the gut in the short and long term really is kind of shows you like improving the gut microbiome has like kind of this holistic, it really does impact so many symptoms, which maybe you don't even think are connected or realize are there. But when you start to when you feel better, you feel better, but you across the board. And I think that's a kind of a really amazing story. And I think if you're a healthcare provider and you want to talk with somebody who really understands and is compassionate to, the challenges that exist and what patients are asking for, reach out. This is what we want to be doing. We want to help and talk and be part of people's understanding of where the gut microbiome plays a role and how FMT can fit in to some of these stories. And check out our website. I'll link. We created a white paper which kind of summarizes everything we talked about here and goes into more detail about the research in this space. Visit the website link, download it, take a look, read through it, and kind of get a better in-depth understanding about what we've touched on today. And reach out to us to ask questions and see if this is a good fit for you as a healthcare provider. And with always the caveat when we talk about research, I will always say this and I will continue to, but we see the benefits of FMT, but we do understand that there is a need for more clinical and large-scale clinical research. One of the big things that plays a role here is we need standardization in how to apply FMT. When is the best time, for how long? And those right now are unknown. And that's why we encourage you to reach out so we can have a discussion and really explain how all of this system works and what the research is saying. And the other side is standardization in terms of donor screening and how that is done. And something that we approach differently is we are reading everything that anyone is publishing about why donors should be screened for. We have an understanding of what's impacting the gut, and we try to screen that out in our donors as well. So we are changing and updating what we screen our donors for as the research in the gut microbiome catches up.
Right. And just in the context of that, right, like we're looking at the extended family of a donor to ensure that there's no early diagnosis of cancer, because we recognize, look, there's something in the microbiome that appears to play a role in some cancers at present that we're aware of that is leading to cancer diagnosis. So if a donor has a family member who has, say, an early onset of a cancer, I mean, everybody eventually, if they live long enough, generally will develop cancer. And so, we can't include people that are in their 80s or 90s, but if someone's in their 30s, 40s, 50s, and they're getting cancer, that's a concern to us. And it might be a reason why to exclude a donor, even if a relative has that. So the donor screening aspect here is, of course, really critical. And that's just an example of it in the context of cancer care.
Yeah. And that's part of the process of understanding how FMT is working and what needs to be in place to increase and enhance both the success, but also the safety of the treatment. So I think to conclude this, I think we've at least summarized the role of the gut microbiome in the oncology space and how FMT may play a supportive role across the board in the different types of treatments that are being used for oncology. And if you are a healthcare professional and this sparks your interest and you've got questions, please reach out. Check out the link in the bio in our description that will cover, will bring you to the white paper that covers this topic.
And Shayna's underselling it. That is such an amazing compilation of the available research to date. I strongly encourage you to take a look at that white paper, read it. Let us know if you got any questions, because we love to get feedback, but also just share it with colleagues, friends, anybody who's going through this. I mean, knowledge is power. And in the context of cancer care, there is quite a bit of, details out there, but this is such a up and coming research field, and we're really excited to be a part of it and really want to get the message out there just for the betterment of research, our clinical understanding, and ultimately patient care, which is what really moves us. So thank you for tuning in. Subscribe if you haven't, and share.
And we'll see you next time with the next exciting topic about the gut and FMT, and making sure that we're helping to educate you on the important role of the gut microbiome. Thanks, everybody.